Hey guys, welcome back to the channel. In today's video, I want to talk about something that's near and dear to my heart, and that is health literacy or health illiteracy. Health illiteracy affects millions of people, particularly the people who are poor, elderly, and the minorities. And this health illiteracy, it impacts a person's inability to make informed decisions about their well-being. The reason I wanted to shed light on this topic is because I think it is very important for each and every one of us to be our own personal health manager. And I want to talk about this in the perspective of where I think the medical field or the medical industry is going, and what you and I can do about it to make sure that we don't get caught in the shuffle. So I want to jump into this video by first giving a definition, a real explanation of what, you a better understanding of what health literacy is and health illiterate is. Okay, so I'm pretty sure at some point in your life you've heard of someone being illiterate. And usually when we hear that term, we always talk about someone's inability, or we think about someone's inability of being able to read or write. Now that that is true, and that is a correct definition of it, but illiterate, synonyms for the word illiterate means ignorant or lack of understanding. I think we both can agree that in somewhere in each and every one of our lives, we're ignorant of something or we lack understanding in something. And this is the situation with health illiteracy. We want to be health literate. The reason that you want to be health literate is because you want to be able to take an active role in your medical care or treatment. It is no longer acceptable, just like I don't believe it's acceptable for anyone in this particular day and age, unless you're very much older in age, to be illiterate. I think you should be able to have a basic understanding or level of reading and writing. So if you are a person who is watching this video who is illiterate, a person who cannot read or write, I don't want you to be ashamed. I want you to go do something about it. If you don't have your GED, you can go and get your GED no matter what age you are. And if you know someone who's in this situation, encourage them to be able to go take their GED or just pick up a book, and even if they have to start in the basics. So let's get back to health literacy. Again, I said it's very important in this day and age for us to become health literate, because the medical system and the medical treatment system is changing dramatically. A lot of doctors really took their oath very seriously, is to do no harm. But right now we're in such a dire state in terms of income and people making a living. You're just another transaction in a doctor's day. And unfortunately, I have experienced this, in my opinion, that I've experienced discrimination. Many doctors really don't want to treat African American patients. So many doctors who are of another ethnic group, they don't value the African American's patient's opinion, and they don't want to treat you and have you as a patient, but they will take you on as a patient and take your money, but they don't want to give you the same level of care. I'm probably one of the best and the worst patients that you can have. I'm the best patient because I'm very proactive and I'm very self-aware about my own situation. I don't expect to go to a doctor and expect the doctor to give me my whole medical history or my background when I live with myself every day. But I'm the worst case scenario because I ask a lot of questions. You just can't tell me something that I'm just going to do it, right? I have the right to ask questions, and I have the right also to refuse whatever treatment plan you are setting forth. Many times doctors would like to prescribe you medications, but they have not done any testing to determine why you have or why they want to give you this type of medication, namely things like antibiotic and pain pills. You know, if you're saying that I need an antibiotic, where's the infection coming from? And so it's a lot of things that you have to know. And you just can't assume because someone has on a white lab coat that they have your best interest at heart. Any doctor who has a connection or working agreement with a hospital, that hospital has a morgue. Meaning, my point is that you can die under the care of a doctor. I know so many people who have taken a doctor's recommendation, did not use their own thought process, did not ask God whether or not this is the right treatment plan. And I'm not against medical care, because in some cases we do need it. I think all of us probably have been a patient at some point. And I think it is great for those doctors who are literally want to do no harm and really want to be proactive with patients versus reactive. It frustrates me a lot. I'm gonna be quite honest with you. I am pro supplements. I am pro medication if you need it, meaning a medication that you need from a prescription from a doctor. But it really bothers me for a doctor to recommend a supplement after supplement after supplement, but they never discuss your dietary needs. They make a suggestion off of one blood work marker, and they want to put you on medication for it, and they have not tracked you over a period of time. You know, in some cases, you know, one time that you have a test results, let's just say if you're, I think it's your C-reactive serum or something like that, I think that's what it's called, that kind of determines whether or not you had a heart attack. Well, if that number is elevated, then obviously you want to respond to that immediately. But then at the same time, if your A1C is high and your blood work is taken today, unless there's some other things, some other indicators that you may be in distress, then this may be something that you need to follow up on over a period of time. But in that follow-up process, they need to give you something that you need to be working on. And that's an issue that I have with a lot of the traditional medicine that is going on right now. What I want you to take away from this video, I want all of us to get to a point that you will learn to read. You need to understand basic nutrition. Nobody should have to tell you what a complex carb is, or a simple carb, or what is a lean protein, or what is a good source of fat. Nobody should have to teach you that information. This is something that you can go read in a book. This is something that you can sit down on YouTube and figure it out. And also, you have to understand when a doctor is seeing patients, they are in a practice. So they are practicing. Doctors practice medicine. God is medicine. And if you're not going to God and saying, Lord, how do I live my life? Are you the person who needs to be on a plant-based diet? Are you the person who needs to be eating a high-fat diet? Are you the person who needs to be eating a high-protein diet? I believe God gives us all indicators of what each and every one of us need to do. And your plan may not look like my plan. And you can't expect a doctor who sees you every 6 months or once a year to be able to give you really good insight on what you should be doing, and you live with yourself every day. We are putting our trust, we're putting our lives and our future in the hands of people who really just don't care. Many times, I'm being honest, many times there are doctors who really do not want to treat African American patients. They really don't want to treat us as patients. They will take your money, but they really don't value your opinion, right? And a large of this is because a lot of times I've seen it. I've seen it with family members of mine. I've seen it with people, other people that I know. You go into these doctors' office, you play around, you go in there acting silly, you don't come prepared, you don't ask really thought-provoking questions, and they sit there and tell you anything and you go along with it, really because you don't want to be there and you don't want to take an active role in your health. What I'm saying to you right now, you're playing yourself silly. You're playing yourself for a fool. I have seen personally myself, when someone took a prescription that a doctor gave them, he knew he shouldn't have been taking it, and he lost his sight. Okay? This doctor was known just to prescribe medications and not really concerned about the side effects of it. This person lost his vision. And once this happens to you, you have now signed over saying, okay, well, I went along with what he said. You can't sue the doctor about it, because the doctor just got this, they got these from these, what are they called? Pharmaceutical reps. They get these trial packets and things like that from these pharmaceutical reps, and they just hand it over to the patients and give it to you to take it, right? And just because one person don't have problems from this doesn't mean that you won't have a problem from it. And my point in this whole video is this right here. you have to become more proactive about your health. You have to understand what your body needs. You have to understand, okay, you may be the person who needs 8 hours of sleep. You may be the person who can't eat sweet potatoes, but you can eat cauliflower rice. Whatever the case may be, a doctor can't tell you that. We cannot expect these medical practitioners to hold our lives in their hands. You don't need to go to the doctor to try to be their friend. You don't need to go to the doctor and you spilling your guts and running your mouth and telling all your personal business, because a lot of that stuff end up in your medical record and you end up having a problem and your insurance company pull your medical records. Then you have a mess on your hands because you've been talking too much. These people are supposed to be therapeutic partners with you to help you come up with a personalized, comprehensive plan for your life. And if you go to any doctor, any medical practitioner who does not want to listen to your point of view, then you find somewhere else to go. I am so tired of people sitting here and spending money with people who don't even respect you. You only got one life. And if you sit here and let people practice on this one life that you have and you don't want to take the active role, you're the fool. You're the one that's going to lose out. So you have to become health illiterate. Y'all, there's information all over the internet. We're watching people jumping up and down, doing workouts and all this other kind of stuff. Figure out what is the individual approach that you need to take. Figure out what is the food that you need to consume. Figure out the workouts that make you feel good and you need to do. You understand? Everybody is an individual. Yes, we are all God's children, but we are not alike. We were created in His image and likeness, not each other's. What makes you tick does not make me tick. What makes you feel good may not be the same thing for me. And understand that you cannot trust and expect a medical practitioner to have your best interests at heart. And God bless the ones who are really doing their job. God bless the ones who really cares about their patients and really try to help people. It's not many anymore, y'all. Many times now the medical institution now is very reactive. They're not looking at prevention. They're not looking into prevention. If you're diabetic and nobody has sat down and talked to you about your diet, you're in trouble. That is the very first thing that you need to look into. If you're overweight and you keep going to the doctor, keep saying I'm overweight, I have high blood pressure, and they have not checked to see whether or not you're insulin resistant, you're in trouble. That person is really not doing a very comprehensive approach to your medical history and creating a treatment plan, which is going to be something that's going to be helpful to you. This frustrates me because, unfortunately, I've seen many people that I cared about suffer from very chronic medical conditions. And a lot of the problems that they had, they caused themselves because they abused their body, whether it would have been through their diet, whether it would have been through recreational activities like drinking, smoking, and these types of things. And once these people start cutting on you and you having to take all these medications and things of that nature, sometimes you get to a point of no return, right? And a lot of times, sometimes these diagnoses go to the extreme in terms of treatment. Maybe you could have if you're a diabetic, I know sometimes you can get so far gone you may have to be on insulin. But there are times when if you're pre-diabetic, you can do some things yourself to change your trajectory of whether or not you're going to be on insulin, whether or not you're going to end up going on dialysis, or you're going to end up having neuropathy, or all those types of things if you just change your diet. But you have to become a student of the sport. It is past the time of us sitting back and letting someone else tell us what to do with your life. At the very least, you need to go to the one who created you. God created you, and He has a specific and a specialized plan for your life for you to follow. And even if it doesn't make sense to somebody else, you do what God has told you to do that's best for you. Become an active participant in your health. Become health illiterate. Don't sit on the sidelines and let somebody else have control of the vehicle that you have been given and only you can occupy the driver's seat of. You are a dealer's only product. Take your concerns back to the manufacturer, the one that created you. Stop putting your hope so much in man and really trust God. Again, there are a lot of doctors who are doing a great job, but there are a lot of doctors who suck and they need to give up their license, and that's even other people in the medical field, nurses, doctors, therapists, all these people. Some of these people are just one slap out and they're in this field because they know they can make money, not really for the betterment of the patient. You have to be your own healthcare advocate, and don't be so impressed behind someone who has a title and you impressed because they have all this education. A lot of these people, this including doctors, lawyers, judges, these people graduated at the bottom of their class. The only difference between you and them, they stood the test of going through 12 years or 14 years of school and specializing in something. It does not mean that they have enhanced their skills beyond that. That's textbook. But working with people is a total different thing. But if you are going to a doctor's office and you know that they don't honor you and respect you as a human being, leave. Your money can be spent elsewhere. Don't be afraid to move on. Love yourself enough to give yourself the best. And the number one thing you can do is, number one, you need to respect yourself and you need to require that of others to do. Health literacy is something I'm going to talk more about. And I want to talk more about also how to, in my opinion, to navigate the medical system and how to really approach doctors and ask questions when you're timid and shy, or you feel afraid or frightened. I know there's something they call the white coat syndrome, when people just totally get, their blood pressure goes up when they go to the doctor's office because they have this fear. I'm not quite sure where that comes from. When you can't articulate yourself and you don't know what you're talking about, these people blow you off very quickly. So be true to yourself and require that other people respect you, but the only way that you can do that is that you respect yourself first. I want you to be bold in this season. I want you to be your personal health manager. You know, it starts with you. You know, forget about what everybody else is doing and focus on what is the best thing for you. And it may look totally different from everybody else, but that's okay. But I would say seek the creator, seek the one who created you. You are a dealer on a product, and only the one who created you can have the best manufacturer instructions on how to keep you running at your optimum. I hope this video blesses you. Share this out to someone who you think can benefit from it. Also, again, like I said about being illiterate, I think it's very unfortunate to be illiterate in this day and age. And if you know someone or even yourself who is illiterate, you know, there's several different ways for you to learn some basic reading skills and writing skills. But really, we need to come to a place of understanding. So I will see you in the next video. Take care, everybody. Be blessed.